Welcome to the virtual clinic. The aim of the virtual clinic is to correctly diagnose your patient in the shortest time possible, whilst at the same time ensuring that your testing is both thorough and complete. The purpose of this video is to provide a quick guide on how to navigate through the course. Here you can see we're at the entrance of the virtual clinic. To enter, just click on the door. Here you'll see instructions for what to do next. If you ever get lost in the clinic or not sure what to do, then click the eye icon, which can be found on the sidebar here. This should be able to guide you. The first person we see in the virtual clinic is Carl. He is the supervisor of the clinic and is here to help you and to give you guidance. He has an opinion on everything, and as your supervisor, it's always best to do what he says. Let's follow Carl through to his office. Here Carl will give us instructions, and he usually tells us to visit the patient's medical records and referral letter. We must do that before moving on to the next stage. The referral letter tells you why the patient has been referred to the clinic. The medical records inform us of any previous hospital visits. Once we're finished reading these documents, we can go back to our supervisor to make a provisional diagnosis. The purpose of the provisional diagnosis is to allow the user to make an informed guess on where the pathology could be from reading the referral letter and medical records. In this instance, we think that everything is normal. Once we've made our provisional diagnosis, Carl will give you some feedback if he agrees or disagrees with your suggestions. We recommend that you use this information to guide your testing. Now it's time to meet your patient. Notice that Carl has assigned trophies to each test which he thinks is essential. So the more trophies you get, the more likely it is that you're going to be able to reach the final diagnosis correctly. Like any investigation, it is recommended to start with a patient interview. Here you can choose from several questions to ask your patient. Once you have found your favorite question, click Submit Question, and your patient will provide an answer. Continue to ask questions, and the interview will naturally reach an endpoint. If you feel you asked the wrong questions during the patient interview, you can re-enter the patient interview at any time and ask different questions. But please note, additional time will be added to your investigation. After the interview, you can perform some tests. We have 72 tests in the virtual clinic, ranging from audiometry to balance testing, as well as evoked potentials. It is important to choose the most important tests, rather than waste time on tests which do not give you much diagnostic information. Once you have finished testing, go back to Carl and make your final diagnosis. Carl may feel that you need to do more testing, but if you disagree, you can continue and make your final diagnosis regardless. Once you have made your final diagnosis, Carl will give you some feedback. The list here shows Carl's preferred order of testing, and in the second column, the order in which you did the tests. This is designed to be a guide, especially for those who did not make the correct diagnosis. The More Feedback button allows you to get in-depth feedback on your test choices. We recommend that you explore this section, as there is a lot of learning which can be achieved here. Once you have finished reviewing your feedback, you can check to see if you are eligible to register for CEU or CPD points. Click the button and instructions will follow on which organisations are currently registered for CEU and CPD registrations. This concludes this quick guide video on how to navigate the virtual clinic.